Hi, my name is Margaret Martin. Today on Meal Your Guide, we're going to be talking on a topic that's especially close to my heart, and that's movements that increase your risk for spinal fractures, or also referred to as compression fractures. Many of my clients come to see me with advice from other trainers or advice that they got from books, and they're doing things that they think is sound and things that they think are the right things for them, and they are trying their very best. But unfortunately, there's a lot of movements that they do that might be good for general public, but not for individuals with low bone density or osteoporosis. And so hopefully by the end of this tutorial, you'll have a good understanding of what movements, be it in yoga or Pilates or just exercises or movements around the house that you may be doing, that you should consider modifying. So in this tutorial, we're going to look at why the spine is more at risk than other bones in the body. And this would be a good time to review, if you haven't yet done, the tutorial on understanding bone. Here, looking at the spinal column, we have on the left normal curves in our spine. We have a normal inward curve in our lumbar spine or our low back, which is referred to as a lordosis. A normal inward curve in our upper spine, which is the cervical lordosis, which is at our neck, and we have a normal small outer curve in our upper back. Now, these look really pronounced on the photo here, but if you look at somebody with good alignment, you'll just see a nice shape to the spine. Looking closely at the vertebral body, we know, and as we had talked about in previous tutorial, that it is composed of a hard outer coating referred to as cortical bone, which surrounds the trabecular bone on the inside, a softer bone, which is also referred to as cancellous or spongy bone. Back in the 80s, we weren't sure whether flexion or extension exercises were a safe thing to give to women with osteoporosis or with people with back pain in general. And so, fortunately, there were physicians who were studying this. Now, for those of you who aren't familiar with flexion and extension, that's why I've brought up these two slides here. These photographs here on the left showing extension exercise and on the right showing a flexion exercise. Back in 1984, Dr. Snacki did a study on postmenopausal osteoporotic women looking at the effects of flexion exercises versus extension exercises. The mean age or the average age for these ladies in the study were 49 to 60 years of age. She had 4 groups, and in these exercise groups, one group did extension exercises, one group did flexion, the other group did a combination of flexion and extension exercises, and the last group did no exercise at all. And then within a year and a half, if they had back pain or if they were due back for a follow-up, they would report back in. She did spinal x-rays and would see whether or not they had sustained fractures of their spine. And this was the findings. The findings were that fractures occurred at a very high rate, almost 90% in the group that had done flexion, that had done sit-up, toe-touch type exercises. The group that did no exercise at all still had a very high rate of fracturing, and the thought behind that is that, for a lot of things that we do in life, a lot of common activities such as picking up laundry, reaching forward, coughing, sneezing, there's a lot of flexion that occurs. So unless we counteract that with some extension, as you see in the third group where they did some extension and some flexion, as you start to introduce extension movements into the spine or into your life, you start reducing your rate of fracturing. The fourth group that did just extension exercises had a very low rate of fracturing, 16% in comparison to 89%. It was very substantial. Looking more closely at what happens with flexion exercises and flexion motion, here we see the image of the spine, and it's actually a beautiful image where you can see more closely that the actual trabeculae or the cross bridges within the vertebral body. And when we do a lot of flexion motions of the spine, as well as side flexion and extremes of rotation, but for today's tutorial we'll just talk about flexion, those motions have been implicated with high forces, and the trabeculae that are weakened in osteoporotic bone just can't withstand those forces. So as a result, they start to fracture. And as you see in this vertebral body up here, you start seeing larger pits where you actually have fracturing occurring of the trabeculae, so much so that you actually see holes or spaces that would be filled with marrow. On the lower vertebrae, you actually see the loss of height of the vertebrae. And what's happened here is that there's been so many forces that the disc is starting to actually push through the vertebrae. And the vertebrae itself is actually quite a bit shorter in stature than the vertebrae above and below it, and that it has just compressed in on itself. And so if we look at stopping the stoop and stopping the progression of this forward flexing of the spine that happens with continual wedge fracturing, like we see on the right, we need to do this at a stage, ideally, where someone hasn't yet fractured, where they're still holding their ear over their shoulder and their shoulder over their hip in nice alignment. Not only is exercise implicated, but all the movements that we do day in and day out. And so we're looking at compressing the spine, or when we're moving, in as best alignment as possible. So here you see Pat, one of my clients, demonstrating how to garden safely, and Pat's bending forward in an unsafe manner here in the upper corner, where she's putting a lot of force in her spine, especially in her mid-back, through this position. Whereas if she took the time to get down and kneel, as she's demonstrating down here, where she's maintaining the nice alignment, and the bending's happening from the knee and the hip as opposed to the spine, that's much safer on the spine. And the trabeculae, the loading through the trabeculae and through the whole vertebral body is much more even. Exercises that increase your chance for spinal fracture, therefore, are all exercises that bring you into that forward flexed position. Flexion and rotation, as seen in the middle photograph, is even more risky, in that you're combining the two motions. And if you think about it, we think about exercises, but oftentimes I'll see women carrying heavy purses, and they go to sit down, and they'll rotate and drop their purse to the side, and that too is a very compressive load in a way that puts your spine at risk. So those are things to consider, looking at how to move well, how to move safely, and not just through formal exercises, but through exercises that have become much more popular, like yoga and Pilates. Yoga and Pilates moves need to be practiced with caution, should be practiced under the supervision of instructors who are well trained in the precautions that need to be carried out for individuals with osteoporosis or low bone density. You do not want to be doing any of the poses that you see here. If you have an instructor who wants more information, or for yourself, we did do a booklet, and I worked with an excellent yoga instructor, J.L. Lindsay, and she and I put together a booklet specifically on yoga, safe yoga practice for osteoporosis, and you'll see reference to that at the end of this tutorial. Best to keep it neutral. So flexion is obviously contraindicated, but extremes of extension are also not recommended. So with all activities of daily living, with strength training exercises, aerobic exercises, yoga, Pilates, extremes for your spine are not recommended. So whether you're grooming your dog, going into the fridge, picking loads up off the floor, or embarking on an exercise program, you do need to move carefully and safely. And I'm proud to say that Amelia Guide does offer you excellent exercise programs that do not put your spine at risk. And so hope this has been a helpful tutorial. That's all for this session, and I'll see you next time on Amelia Guide.